Hello, my name is Dr. Ashley Jordan. Thank you for the opportunity to present our work today on incisional negative pressure wound therapy in post-bariatric body contouring. There are no disclosures. Over 200,000 bariatric surgeries were performed in 2017, and this number is only expected to increase in the years ahead. As patients become more aware of surgical options for weight loss, there is an increasing need for body contouring surgery. Post-bariatric and massive weight loss patients have a different complication profile than the non-bariatric patient. When these patients undergo body contouring procedures, they are at a 60 to 87% increased risk of having a complication. Studies have listed overall complication rates ranging from 28% to 80%. The benefits of negative pressure wound therapy are widely accepted. Plastic surgery journals have shown a decrease in wound healing complications with the use of incisional negative pressure in reduction mammoplasty and breast reconstruction. However, to date, there has not been a large study on the effects of incisional negative pressure wound therapy in the post-bariatric body contouring population. We sought to determine the effects of incisional negative pressure wound therapy on wound healing complications in the massive weight loss population undergoing abdominal body contouring procedures. We hypothesized that patients with incisional negative pressure wound therapy would have a lower complication profile than what is quoted in the literature. We performed a retrospective cohort study of massive weight loss patients from December 2016 to April 2019. Patients were non-smokers whom had an abdominal body contouring procedure performed by a board-certified plastic surgeon who applies incisional negative pressure wound therapy to all incisions as his standard of practice. We performed an extensive chart review and analysis of post-surgical complications. The primary outcome sought was overall postoperative complication rate. Secondary outcomes were minor and major complication rates. A total of 72 patients were evaluated. 92% were female and 8% were male. Mean age was 47 years old. 81% of patients were status post-bariatric surgery. It has been reported that patients with a BMI greater than 25 multiplies the risk of postoperative complications by 3. The mean BMI in our study was 31.29. Our study's overall complication rate was 62.5%. The majority of complications consisted of minor wound complications. This cohort consisted of superficial wound breakdown that required, if anything, local wound care. Rate of dehiscence was 2.8%. Infection and hematoma rates each contributed 8.3 to the overall complication rate. Seroma rate was 5.6%. Our overall complication rate is within the range quoted in the massive weight loss literature. Almost half of the complications were minor. Major complications were much lower than rates reported in similar studies. We postulate that incisional negative pressure wound therapy may have the capability to downgrade the severity of wound healing complications, taking what would have been a major complication, such as wound dehiscence, and de-escalating it to a minor complication of superficial skin breakdown. This theory is based upon the underlying mechanics of incisional negative pressure wound therapy and a very low rate of major wound healing complications. Body contouring is often the last step in a patient's massive weight loss journey. It is the responsibility of the surgeon to optimize their patients. Post-operatively, utilizing incisional negative pressure wound therapy may help decrease the incidence of major wound healing complications in this high-risk population. While we understand these results cannot be generalized, they should underscore the need for additional investigation. Thank you.